Hi, my name is Christopher Baker, and we're here today to show you how to utilize the Anika Integrity implant. In the first case, what we'll do is utilize the implant for a graft augmentation of a partial thickness rotator cuff repair in a simple onlay fashion. All right, the procedure will be performed in the left lateral decubitus position. So this is the patient's left shoulder upright. We got the back side of the shoulder and the front side of the shoulder here, posterior lateral acromion. I like my posterior portal to be about 45 degrees off the acromion, about 1 finger's breadth down. I like to center my lateral portal based on the humerus, not on the acromion, 1 finger breadth below the acromion. And then the anterior portal will be somewhere in front of the AC joint based on localization. So our goal first is to make sure that the bursal side is also intact. And in this case, we can see it probably is most likely to be intact. I'll take the 18 gauge needle, please. And again, just localizing with our needle is helpful. I'll take that knife back. Go ahead and pull that needle for me. We're going to make a relatively large lateral portal here because we're going to be utilizing a soft cannula that's going to hold back our deltoid fascia. It'll help with insertion and visualization. If you want to perform a subacromial decompression, I'll usually perform that before I place my portal into position. I'll take the shaver. Just stick it on top of there if you could. It's important in any arthroscopy, I think, not to violate your deltoid fascia, so we want to keep this lateral tissue intact as we clear our subacromial bursa. We're just going to simply touch the bursa and not get into that deltoid fascia. As soon as I have a little bit of exposure here, I'm going to stop. And because we can see our cuff very nicely, there's no reason to go overboard with our preparation. Come hold this for me. These soft cannulas, there are several in the market. There's a smaller diaphragm and a thicker diaphragm. The smaller diaphragm goes deep into the shoulder. You can simply fold it in half and use a simple towel clamper or whatever you like to put it in. You'll then go into the subacromial space. Hopefully this is large enough. I'm going to open that up a little bit. Yeah, hold that right there for me. I think I was hitting you. And then once that's into position now, it will hold back our fascia from our face as we're operating and placing our implant into position. And then I can simply fan it out here. We're going to take our skid. This is just a metal skid that's going to open up the fenestrations within the cannula to allow us to place our implant into position. So you can see here we place that till we're down to the bone, as in here. So the implant goes in all as one. We have our PEEK staple in position. We have our Integrity implant in position, and we've pre-bent our inserter device. So this device is going to simply deploy the graft into the subacromial space. I find that if you bend this, what it does is it pushes the graft underneath the acromion. If you don't bend it, it pushes it down into the bone, and it will have some difficulty for you to place it into the subacromial space. So in order to insert it, you have to rotate and basically slide the graft up over top of the wheel to get it into the joint. So what I'll do is I'll place that graft over top of my wheel. I'll get it into the cannula, and then we're going to watch it come in. And I'm going to find that lateral tuberosity again. And then we're going to impact that into the bone. Go ahead and impact this down. Yep. Keep going. Got pretty hard bone here. Good, you're down, okay. We're going to then remove the metal skid. You'll see that distracts the cannula a little bit. And then I'll simply push my wheel out. We're at a little bit of a downward angle here, so I didn't want to rotate too much on the cadaver there, so I'm just trying to deploy it. Our angle of abduction isn't great, so it's going to be just a little bit of work to get it there. Okay, so our implant is now in. So now this can be done through either 1 or 2 cannula insertion. Because we have a partial tear, I like to do these through a single cannula. So you can see the implant is fully deployed in our subacromial space. So you do have the option here where you could create a lateral portal. Hold that for me. If you wanted to, you could simply take your standard lateral acromial portal, and you could place your next sutures through this insertion site. I do this for double row repairs that I've already done a formal repair on, but since we're going to be doing an onlay, I like to preserve that, so hold the camera for me. I'm simply going to remove the wheel, and then I'm going to remove the insertion handle. All right, so the insertion handle is now out, and now we're still in position, and then through our lateral portal, we're just going to continue with our insertion and implantation of the implant. And working from lateral to medial, I'm simply going to work from lateral to medial, anterior to posterior, posterior to anterior, stretching the graft over our defect in the shoulder. Go ahead and get the mallet.
Yep, mallet.
Yep, go ahead and tap it in. Hold on a second. Try not to steer it. Internally rotate the arm for me. Because I'm at an angle, we're just going to internally rotate the arm a little bit. Good. All right, go ahead and tap it in.
Okay.
Good. All right, pack it out, take it out now. We're going to remove the insertion handle. I think our cadaver's frozen. Okay, and then we're going to externally rotate, and we're going to load another staple in position.
Yeah, I agree.
And then externally rotate a little bit more. All right, and go ahead.
Okay.
Hold on one second. I want to come on the other side of this. And you can manipulate this graft. The benefit of the strength of it at time zero is you can manipulate it. Go ahead. So now we're going to insert this all the way down. Good. Good. And then now we've got two that are down. Then we're going to go one more anteriorly. And these come in both 7 and 8 millimeter lengths. I generally get longer as I get more medial, so I'll typically start with the 7s, and then I'll go with the 8s. So again, we'll work from lateral to medial, anterior to posterior, good. And you can stretch this graft and internally rotate. I'm just going to keep going back and forth from anterior to posterior to stretch the graft. Yep. And then the biologic strength will come in over time with our hyaluronic acid component. We'll place another one. And you can see here we can work at really acute angles. A lot of other implants on the market, if you try to work at these angles, it's going to cut through. Good. It's going to cut through your implant. We're not going to have that happen in this case. Go ahead and externally rotate now. Good. Oop. And I like working with these soft cannulas because it just affords me this visualization. Go ahead. Okay. Very reliably. The hard cannulas will work as well. I just find this easier, good, to pull back that tissue as I'm working. And there's no right answer for how many to use. You go another gun? We'll go like 2 more. I just like to get as much stretch on the implant as I can. And again, we're at like nearly a 60 or 80 degree angle here. Good. And I'm still not concerned about it cutting through my implant. Good. Another one. I'm going to go more central with this one because we're at the medial most aspect of the implant. And again, look at this insertion angle all through one cannula. Yep. Good. Good. And we'll do one more just for the picture of it. Go ahead and internally rotate. Just a touch, yep, perfect. Obviously, the better the tissue, the thicker the tissue beneath, the better those bites on those anchors are gonna be. The more compliant the tissue, good. Or the looser, go a little bit deeper. Or the weaker the tissue, the more motion will occur at the tissue junction. So that's a pretty typical picture of what we're gonna get in an onlay repair. You can see I can manipulate it here. We've got good tension. But in this case, I'm very comfortable with what that looks like. I think our fixation is great, and I'm not too worried about it. And we'll get a little on-face look as well here to show you kind of the overall lay of this. This typically takes me under 5 minutes in my OR, in addition to any repairs or other things that I do. I don't have to change any of my normal techniques, and we get a pretty consistent result each time.